integrity of the MCL, the medial collateral ligament. Okay, the Vera stress test tests the LCL, or the lateral collateral ligament. Okay, so again, always non-injured first, but I'm going to do the injured Vera's test on her. So scoot over to the edge. Okay, you're going to do it in two different positions, both tests, at 0 degrees of extension and at 30 degrees of knee flexion. Okay, so you want it at 0 degrees of knee extension. Relax, 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 relax. Again, if they're not relaxed, you're going to get a false test, right? And what you're going to do is I'm going to provide a varus stress. Now, I'm using my body as a fulcrum. So I'm putting one hand on the medial joint line. Okay, my right hand. My left hand is at the shaft of the tibia, okay, on the outside of her leg. I'm using my body as a fulcrum as I try to open up that joint line. So what I'm doing is I'm pushing her into a varus stress with my right hand, and I'm using my body. So essentially what you're trying to do is this. Using my body and using my hand, I'm trying to open up the joint. Okay? And see if there's any laxity. You guys can stand up and move around if you want to. So I'm here. So all I'm doing is using my body like this to open up. If you guys can't see, you gotta move. Okay? And open up the joint. Obviously she has none. I'm looking at the LCL ligament. Okay, so you guys, it's important to know where your anatomy is for these ligaments as well. All right? So I'm looking at to see if that joint opens up or gaps versus her non-injured side. If I have a positive varus test at 0 degrees, you will think it's the LCL and possibly the ACL. Okay? Because the ACL is taut at 0 degrees. So if it's torn, you're going to get that gapping of the joint as well. So if you have a positive test at 0 degrees, you will suspect LCL and ACL. At 30 degrees, I'm going to do the same thing. Okay, and it's not rotation. Okay, the leg should stay nice and straight, and all you're doing is pushing the joint into varus stress. If I get a positive test at 30 degrees, you actually throw out the ACL, and you're left with just the LCL. Okay? The reason is at 0 degrees, the cruciate ligaments are taut, and at 30 degrees, they're lax. So you shouldn't get any involvement of the cruciate ligaments at 30 degrees. But if you still have a positive test, then that means it's LCL that's involved. Yes?
How painful would this be if you had a torn LCL?
It's going to be uncomfortable. Yeah. Okay? Now, for a valgus stress, I'm going to scoot you this way because I'm going to use this leg because it's easier to see. Okay? So now I'm on the inside of her leg. Now I'm going to use the opposite hands. So here I'm going to use my left hand at the joint. Oh wait, I'm doing the wrong test. Hello. On the outside, sorry. Relax, relax, relax. Now my hand is on the lateral side of the joint. Okay, still same position here. Her foot's tucked underneath my arm. Because now I'm going to provide a valgus stress as I try to open up that medial joint line. Everyone see?
No.
And you're just trying to see if there's gapping at that joint. Okay? Again, at 0 degrees, MCL and MCL and ACL. At 30 degrees, relax. If I get a positive test, it's just MCL. Okay? So valgus and varus stress test at 0 degrees and 30 degrees. so this is just another example. Okay, so what's important here that I see people mistakenly do is where your hand placement is. Okay, it should always be at the joint line. Okay, depending on which way you're trying to push the joint. Now, a Lockman's test is probably the best test to determine if an ACL is ruptured or not. Okay? Now, I'm going to show you two different Lockman's tests. I'm going to show you this Lockman's test, and then I'm going to show you what's called a modified Lockman's test that I will do pretty much 9 times out of 10. All right? With a Lockman's test, you are going to test them at approximately 10 degrees of flexion. Okay? Again, similar to what we did with the anterior drawer, we're actually going to do the same motion that the ACL prevents. Okay? To see if we have laxity. Because think about it. If the ACL prevents anterior translation and we're doing anterior translation, if there's no ACL there, what's going to happen? You're going to get anterior translation, correct? So that's what we're looking at. So for the Lockmans, you're going to wrap one hand around the distal femur. The other hand is going to be wrapped around the proximal tibia. My thumb is on the tibial tuberosity. Okay? What I want to do is, again, she's nice and relaxed. Make sure those hamstrings are nice and relaxed. She's approximately 10 degrees of flexion. And I'm going to pull the tibia forward. My right hand, the hand that's on the femur, is not moving. It's just stabilizing the femur. That's it. My left hand is doing the work. It's pulling the tibia anteriorly. And if I get increase in laxity, then I'm going to know that it could be torn. Okay? Versus her non-injured side. So remember, non-injured side is always first. You got to know what normal feels like. Correct? All right. Now, we can talk about infields and things like that, but that's for 305 to you guys for really to learn infields. Okay? So I'm not going to worry about that. That's a Lockman's. Now, if I have a tree trunk for a leg that I'm evaluating, all right, I will have a very difficult time because my hands are small to get my hands wrapped around a leg. So probably what's going to happen is I'm going to get some rotation, which I don't want, because I'm not able to grasp that femur. Okay? So a modified Lockman's. And they might do it prone on the video, I'm not sure. But I don't like prone. I like supine. A modified Lockman's, I get my thigh underneath her femur. Okay? Therefore, I have more grip on her femur when I can use my whole hand to stabilize the femur versus just here. Okay? So I'm going to get my leg under her femur. That pretty much puts it at 10 degrees of flexion. I can stabilize her femur from the top with my entire hand. And again, my bottom hand is wrapped around her tibia, and again, I'm pulling her anteriorly. Do you feel a difference?
Yeah, I do.
Yeah, much more stable here.
Yeah, it is.
Okay. So for those of you who have small hands, and I don't care for those of you who have big hands, if you want to do the modified Lockman's, by all means, you can do it. So if you pull that card, I don't care which way you do it. It's up to you, as long as you're doing it correctly. Okay, so much more stable for her, even though she has small thighs. So usually this is my choice. I usually do this on everyone because I get a better diagnostic tool. Okay? Any questions about the Lockman's? Okay. Are you still good? Or do you want me to use someone else?
Oh, I'm fine.
Okay. Now, Apley's compression for the knee is for the meniscus. Okay? Because what does our meniscus do in our joint? It shock absorbs. Prevent shock absorption. Okay? Let me try that again. It is a shock absorber. It prevents shock from occurring. So what we want to do with Abley's compression test is we want to shove those meniscus into the joint. Okay, and then we get to do some rotation. Because if a meniscus is torn and you're compressing the tibia into the femur and then you rotate, what's going to happen with that torn meniscus? It's going to hurt. Yeah, and sometimes it might get caught and you're not able to turn the leg anymore. So it's a pretty easy test. Flip over for me.